Good morning, everyone. Thank you so much for joining the Department of Medical Assistance Services this morning. We are here for our live Q&A for our members for the Cardinal Care Managed Care. And so we want to thank you so much for taking the time to be with us today. We also want to thank the many individuals from the agency as well as our MCOs for being present today to answer, I know, what is going to be some lively questions. So let's go ahead and get started. So as you see before you, we have the agenda for today. We've already done our welcome. If you would like to say hello, please do so. Also, we have with us DMAS and managed care plan representatives. We have managed care representatives. The goals of the presentation really is to provide an overview and recent upcoming changes to the Cardinal Care Managed Care program, to discuss the launch of the new Cardinal Care Managed Care health plans that will be effective July 1st, and to allow the health plans to introduce themselves and provide additional information about their plan. We also have a live Q&A session that will advance after the member educational session viewing that will take place. And we encourage you all to place your questions in the Q&A section. I know that you have plenty, and we want to make sure we're able to keep up with them and also make sure we're able to aggregate them and get them to the appropriate subject matter expert for today. During the live Q&A, we'll go over some foundational, some guiding principles and guidelines for you to follow while we're going through those Q&A sessions. So please be on the lookout for those immediately following the viewing of the educational session. And then we'll wrap up with some next steps and where you can go to find additional information if necessary. All right, so now we're going to actually play the educational session for you right now. Hopefully this will give you some additional information regarding what we will be taking questions about today. If you have any questions for us, again, as I said before, don't hesitate to place them in the Q&A so that we can get them answered for you. Welcome and thank you for attending our Cardinal Care Managed Care member educational session presentation today. We have much to share and hope that you hang with us as we discuss what's on the horizon for Cardinal Care. The agenda for this presentation allows for us to accomplish the following goals: provide an overview of recent and upcoming changes to the Cardinal Care Managed Care program, discuss the launch of new Cardinal Care Managed Care health plans that will be effective July 1st, and allow the health plans to introduce themselves and provide additional information about their plan. So let's jump in. What is Cardinal Care? Cardinal Care is DMAS's program name that includes all Medicaid members served through managed care and fee-for-service delivery systems. What's the difference between managed care and fee-for-service? Medicaid managed care is a healthcare delivery system in which the state contracts with managed care organizations, or MCOs, also called health plans, to provide Medicaid benefits and additional services to Medicaid members. More than 94% of Virginia's Cardinal Care members are enrolled in managed care. In fee-for-service, the state contracts with and reimburses healthcare providers directly for covered services, for covered benefits and services delivered to members. Members who are not enrolled in managed care include new enrollees for the first 1 to 2 months of their coverage, new members placed in fee-for-service before their health plan enrollment begins, and members enrolled in a limited benefit Cardinal Care program such as Plan First, and individuals granted retroactive coverage periods. Everyone else is enrolled in managed care. Cardinal Care Managed Care, or Ccmc, is Virginia's Medicaid and famous managed care program. So who does what in this system? DMAS provides oversight of the Cardinal Care program. It also has a 2-level fair hearing appeal process for MCO members. It is important to remember members who wish to appeal a benefit decision that they disagree with from an MCO must first exhaust the MCO appeal process before filing and requesting a state fair hearing with DMAS. The Virginia Department of Social Services and local Department of Social Services offices manages many applications in all renewals. They can assist with eligibility-related questions and concerns. Now, please note that the Virginia Department of Social Services and local Department of Social Services offices are not able to assist with MCO enrollment or benefit questions. The Cardinal Care Enrollment Broker is a DMAS contractor that manages the MCO enrollment process.
The support they provide will be discussed in more detail later in this presentation. Lastly, the managed care plans administer Cardinal Care benefits and services to their enrollees. They can assist with questions and concerns about their networks or the providers they contract with to provide care to their members, care coordination, covered benefits, and access to care. Transitioning to the new Cardinal Care Managed Care contract is the final phase of the Cardinal Care Managed Care project and what we are here to talk about today. Cardinal Care Managed Care, or CCMC, was launched in January 2023 to enhance Virginia's Medicaid managed care system. Through the program, Virginia has consolidated the two previous managed care programs, CCC Plus and Medallion 4, into Cardinal Care Managed Care. They have defined transformation goals for the program, and they have reprocured or reselected and recontracted managed care health plans to improve the CCMC delivery system and better serve members. New Cardinal Care Managed Care contracts will be effective July 1st, 2025. So what will stay the same? Eligibility rules are not changing. This is an enhancement of the care system, not a change that will enroll in Medicaid or FAMUS. You will continue to be enrolled in Cardinal Care as long as you remain eligible for Medicaid. This is all about choice. Members can still select the health plan that works best for them, which is of course a sigh of relief. We will talk more about the resources available to help members do this later in this presentation. So what will change? We are welcoming a new health plan, Humana Healthy Health Horizons of Virginia. And our returning health plans are Aetna Better Health of Virginia, Anthem Health Keepers, Centera Health Plans, and United Healthcare of the Mid-Atlantic. Open enrollment dates will be the same for everyone and based on the region you live in. The dates are posted on the Cardinal Care Enrollment Broker website in the Virginia Cardinal Care mobile app. So if you have not downloaded it, please consider doing so today. FAMUS members will use the same process and have access to the same MCO selection help as Medicaid members. Each plan will continue to offer enhanced benefits to their members, but the specific benefits may change from the ones they currently offer. There is enhanced Cardinal Care Managed Care coordination, which is now available to all Cardinal Care members. As you can see from the diagram, the level of care coordination will be based on your needs, not just the type of Medicaid that you are enrolled in or diagnosis. The new model is designed to adjust as your individual needs change. The Cardinal Care Managed Care Health Plan care managers partner with providers to support members. Care coordinators will provide supports for medical and non-medical needs. Medical needs may include health risk assessments and development of a comprehensive care plan. Wraparound services will be established and will address non-medical needs such as housing and food access. Now take a look at this beautiful slide. It lays out the special health plan selection period from June 15th through September 30th. During this time, all Cardinal Care members can review their health plan options and choose to remain in their current plan or change their health plan. A new selection can be made at any time during this enrollment period. The date that a newly selected plan will begin depends on the date that you selected. If you choose a new plan on or before the 18th of a month, it will begin the 1st of the next month. Plans selected after the 18th of the month will start 2 months later, also on the 1st. If you choose to stay where you are, but you want to change later, there is an annual open enrollment to select a new plan in the future. Open enrollment dates are on the MCO website, can be obtained from the call center or on the Virginia Cardinal Care mobile app. Again, if you have not downloaded it, we encourage you to do so today. So I mentioned the Cardinal Care Enrollment Broker earlier. So let's talk about how they can help you. They can help you compare provider networks. Provider networks are the providers and healthcare facilities covered by each plan. They can also help to compare enhanced benefits to make sure you have the information you need to select the plan that is best for you and your family. There are 3 easy ways to compare and enroll in the Cardinal Care Health Plan. The first is by downloading the Virginia Cardinal Care app to your Android or iPhone, which is our newest and most exciting choice. The second is by visiting the virginiamanagedcare.com. Again, that is virginiamanagedcare.com online website. And the third is by contacting the Managed Care Helpline at 1-800-643-2273. All 3 options provide the same resources and supports. so use the one that works best for you. Continuity of care. Requirements protect a member's care from interruption when they change health plans. If you choose a new health plan, the new plan must allow you to continue to see your current providers for up to 30 days. Even if your provider is not in the new plan's provider network. The new health plan may extend this time frame if needed to ensure you can continue to access care. A dual eligible special needs plan is a Medicaid Advantage coordinated care plan for individuals who are eligible for both Medicare and Medicaid, aka dual eligible enrollees. Dual eligible special needs plan enrollment is optional. Traditional Medicare and Medicare Advantage plans are still available. Existing Medicaid enrollees may be automatically assigned to a dual eligible special needs plan when they first become eligible for Medicare. These people can opt out of the dual eligible special needs plan and enroll in traditional Medicare or a different Medicare Advantage plan. Effective January 1st, 2025, if enrolled in the dual eligible special needs plan, the dual eligible special needs plan and Medicaid MCO must be administered by the same company. An example of alignment is shown in the diagram on the slide, where both the dual eligible special needs plan and the Medicaid managed care is administered by Health Plan A or Health Plan B. We are excited to share that Anthem Healthkeepers has been selected to administer a single statewide foster care specialty plan under the Cardinal Care managed contract. Foster care, formal foster care, and adoption assistance is eligible for this coverage. The Anthem Foster Care Specialty Plan includes additional supports and care coordination for these populations due to their unique needs. All eligible members will be automatically enrolled into Anthem's Foster Care Specialty Plan unless the member elects to opt out. There are community-based resources that can provide Cardinal Care members with independent assistance and support. For more information, please contact Medicaid Managed Care Advocates and Medicaid Application Assisters through their respective contacts. This concludes the DMAS portion of the presentation, and now we will hear from the health plans.
Aetna Better Health of Virginia has been proudly serving Medicaid members across the Commonwealth for nearly 30 years. We have a deeply rooted presence in our community, which allows us to be able to understand the unique needs of our members and build strong relationships with healthcare providers. Choosing Aetna means choosing a trusted partner in healthcare. We support you on your health journey because healthy happens together. We offer a wide range of enhanced benefits to support our members. It's important to note that some benefits may have restrictions, so it's important to always visit our website for the latest and most up-to-date information. Go to aetnabetterhealth.com/Virginia. For all members, members can access vision and hearing benefits, free rides to local resources up to 30 round trips, free meal delivery for 7 days after hospitalization, free cell phone services, diabetes management through My Active Health, access to GED and career resources and GED test fee coverage up to $120, $500 for supplies for higher education, military, trade school, a medication lockbox for opioid users with children at home, $250 toward ESL classes, $150 toward the removal of human trafficking or gang-related tattoos, $300 for legal housing support for tenants. For moms and kids, members can receive 300 free diapers for new moms, an annual sports physical for kids, free swimming lessons, and 24/7 breastfeeding support through the Pacify app. For elderly members and those with certain health conditions, members can receive support through our Asthma Care program, a curated therapeutic resource box for members with anxiety, depression, or elderly adults in nursing facilities, and an electronic companion pet for members with memory care issues or intellectual disabilities. Our unique programs and services are tailored to meet the specific needs of our members. Our Maternity Matters program ensures that pregnant members receive dedicated support from experienced care managers. All pregnant members up to 12 months postpartum are assigned a maternity care manager. Our Justice Involved Care program addresses the needs of individuals transitioning from incarceration, providing essential resources and peer support. Additionally, we recognize the importance of mental health, particularly for children, and we have developed kits to assist families facing these challenges. Finally, our menstrual care benefit is also one of our enhanced benefits. It allows eligible members to access period care products like pads, tampons, and more conveniently. At Aetna Better Health of Virginia, we know that it takes a village, and our members are at the heart of everything we do. We want our members to understand their rights and responsibilities, which are essential for receiving optimal care. The ability to file grievances or appeals is also important and empowers members to advocate for themselves without fear of losing coverage. We encourage open communication between our plan and our members. You can visit our website for more information about member rights and responsibilities, plus how to file a grievance or appeal. Visit aetnabetterhealth.com/Virginia. Providing clear contact information and support resources is important. Aetna's member services line is available around the clock, ensuring that help is always available. Just call 1-800-279-1878. We also have a behavioral health crisis line and a 24-hour nurse line. Again, just call 1-800-279-1878, then choose the right prompt. We're dedicated to addressing your urgent health needs. Additionally, language support services are available to ensure that all members can access the help they need no matter what language they speak. For more information about our plan and to access our provider directory, just visit aetnabetterhealth.com/Virginia. We're always here for you.
I'm excited to share the benefits offered through participation with Anthem Health Keepers Plus. Our goal is to be your lifelong trusted health partner. For nearly 3 decades, we've provided Virginians with personalized care that fits their unique health goals. Our goal is to earn your trust and grow a meaningful partnership. We have a 300-person care management team living and working in every region of Virginia. Our teams are here to connect with you, listen to understand what you need, and help you create a plan. We will work with you to find the right healthcare providers, set up appointments, and connect you to important resources. We ensure you receive the best possible care by maintaining an extensive network of physical and behavioral health care providers. We train our care managers to provide culturally responsive support that centers what matters to you. If you have challenges with your health, we want to be the first person you call for support. We're here to help find solutions to your unique problems to get you back on track. Our commitment to you also means a commitment to your community. We develop strong relationships with community partners that support wellness in every aspect of your life. Assuring that you have housing, nutrition, and wellness resources is a priority. Our many value-added benefits are designed to give you extra support beyond the typical services that are paid for by Medicaid. For youth, these extras include access to books for education, grocery gift cards for nourishment, youth club memberships for engagement, and sports physicals to keep them active. For adults, jobs have the potential to provide us with independence, confidence, social connections, and meaning in life. Employment support is crucial, and we assist by covering GED testing fees and applications to support educational goals and career advancement. Our transportation services make sure that you can get to medical appointments, pharmacies, and essential services. Some members qualify for a free smartphone preloaded with digital health apps, ensuring that you have 24-hour access to care and increased hearing aid benefits for those in need. Having the right support can make all the difference, and we ensure it extends beyond traditional services. Whether it's in-home delivered meals post-hospitalization or assistance with obtaining identification, we provide crucial support that makes your days easier. These and other benefits collectively provide over $5,000 in total value per member each year, highlighting our dedication to investing in your wellness journey. Now I'd like to share some of our specialized member programs. Concierge Care is a program in pregnancy and newborn care, which provides real-time consultations with experts to clarify expectations and offer helpful tips. Our Pomelo program provides 24/7 support for moms, covering everything from nutrition and breastfeeding to baby care and postpartum support, and gift cards for baby essentials. There is no health without mental health. We are here to make sure that you can get connected to the right type of mental health or substance use disorder care as soon as possible. Our coordinated care program offers specialized in-person intensive support for members with complex needs. We also offer immediate access to urgent, short-term mental health support through Live Health Online. If you have a behavioral health crisis, we have a dedicated team, including peer recovery specialists that will immediately reach out and make sure you have the support that you need to avoid continued stress and disruption. For our members who need long-term support and services, programs like CareBridge and in-house service facilitation provide a streamlined care management approach with a single point of contact, ensuring timelines and accuracy in care delivery. We also provide benefits such as asthma relief aids, health monitoring tools, and meal delivery after hospital stays that help you with your independence.
Whatever the age and stage of our member, our foster care specialty plan has a plan in place to ensure wraparound services to youth and all families connected to foster care and adoption, including kinship families. With a strong partnership with the state, our mission is to improve the lives and well-being of our members. The Anthem Foster Care Specialty Plan is designed to support you. We have dedicated local community-based teams and a dedicated support line, and teams of specialists that are experts in transitioning youth needs, education and employment, judicial support, family preservation, and post-adoption support, all dedicated to support you and improve your well-being. Our plan is packed with exciting, exclusive benefits tailored to enrich lives and build better futures. For members aged 18 and older, we offer access to GED assistance with up to 4 vouchers for the GED test, opening new opportunities for personal growth and achievement. Stay connected and empowered with a complimentary Chromebook for eligible members age 17 who complete a health screener. This device is an invaluable tool for advancing education and career prospects. To further support our youth's confidence and comfort, we provide a $100 yearly gift card for clothing essentials. Prefer shopping at Walmart or Old Navy or local thrift stores? No problem. Plus, eligible youth aged 8 and older can receive up to 4 $25 gift cards to purchase personal care and hygiene products. Celebrate family together with options for a family game night or family movie night package, featuring a $50 restaurant gift card to create lasting memories and cherished moments. For youth transitioning out of foster care, we offer comprehensive support to empower their steps towards independence. Our benefits include transportation essentials like a $100 gift card for transportation support. We're committed to empowering the state, youth, caregivers, and families with a tailored suite of program solutions. We offer support for youth independence, social emotional education, caregiver resources, family toolkits, and more. Our initiatives, such as flex funding for permanency and social needs and specialized training for providers, are designed to help our youth and families to thrive. Anthem Foster Care Specialty Plan is more than just a plan. It's a community dedicated to your success and happiness. Join us in our mission to ensure that every child and family connected to foster care thrives. These exclusive value-added benefits are available only through the Anthem Foster Care Specialty Plan. For a full list of our exclusive benefits, contact your Anthem Care Manager or visit our website at www.anthem.com/Virginia/Medicaid to learn more about how we can support you. Together, let's create pathways to brighter futures.
Thank you for entrusting us as your healthcare partner. We remain dedicated to providing personalized, proactive care to promote the health and well-being of you and your family. Please get in touch with us for assistance or inquiries. Support is always just a call away. Anthem is committed to member rights, assuring fair treatment, privacy, and the ability to participate in decisions about your health care. Your rights are protected by laws, including the American with Disabilities Act, safeguarding your access to safe, timely care and the ability to update your medical records or report any issues. If you experience dissatisfaction, you can file a grievance at any time, with a decision communicated back to you within 90 days. Appeals against any service denial can be requested within 60 days, with expedited options available for urgent needs. You can file grievances via phone, the Secure Member Portal, or by sending a written request. A representative can act on your behalf to ensure all concerns are handled effectively. It is important to us that we hear your voice and take care of your concerns.
Welcome to Humana Healthy Horizons. Humana has created a fresh brand in Medicaid using our unique capabilities. For more than 60 years, we have been helping people improve and maintain their health. This is done through clinical excellence and coordinated care. We have more than 1.3 million Medicaid members with 30 years of Medicaid experience. We serve our members from birth through aging. Humana has you covered whether you're enrolled in Medicaid, Medicare, or both. Humana can help you in many ways. Here are a few of those ways in which we are willing to assist you as a member. Improving member experience. We provide an app called Go365, which is a well-being and rewards program that our members can access 24 hours a day, 7 days a week. We also make sure you have access to a variety of providers to assist you with medical needs and services. We focus on quality health care by providing a 24-hour, 7-day-a-week nurse advice and crisis line, and provide access to wellness and preventative services. There are dedicated care managers who will work with you and your caregiver on your healthcare needs. We partner with communities to help with food and housing needs, and we provide personalized member programs such as Humana Beginnings, our maternity care management program, and peer support programs. We're pleased to offer several enhanced benefits to meet the needs of our members. Our enhanced benefits are designed to enable person-centered solutions. These benefits focus on healthy families, health-related social needs, quality of life, convenient care, and preventative benefits. Healthy families include those things that support family well-being, providing fresh and nutritious produce boxes to pregnant and postpartum members, promoting a healthy pregnancy, also supporting children and following their interests. Health-related social needs focuses on health and well-being, empowering each member to address health-related social needs. Quality of life, empowering members to live in their least restrictive setting of choice and improving life satisfaction by offering accessible and personalized support. This includes fall prevention kit and PERS that can reduce the risk of a fall by addressing environmental hazards and providing immediate access to emergency assistance if a fall does occur. Convenient care supports personal responsibility and access to appropriate care. We provide a $65 quarterly allowance for over-the-counter essential care items, helping to save money and maintain overall well-being. Preventative benefits are designed to assist members take control of their health and well-being, ensuring our members can lead healthier, happier lives using prevention and condition management activities like weight management coaching, tobacco and vaping cessation, our Go365 app wellness platform, and additional vision and hearing benefits. For a complete list of enhanced benefits, please refer to our member handbook, which can be found on our website or call member services. It is important that we engage our members. Our care management and care coordination model consists of a person-centered approach, using the best practices and services to inspire our members to improve their health. We actively include and engage our member or their representative to develop and manage their comprehensive care plan. Address member population needs across the member lifespan, combining physical and behavioral health, environmental and health-related social needs, care, and services. Care coordination extends the reach of clinical programs to lower acuity members with short-term needs to manage their health and health-related social needs. The care management and care coordination also provide specialized support teams. For more information, please refer to our member handbook, which can be found on our website or call member services. Members' rights and responsibilities. As a member of Humana, you have the right to be free from discrimination, be treated with respect and consideration for your privacy and dignity, get information about your health plan, provider, coverage, and benefits, and obtain information in a way you can easily understand, including interpretation, written translation, and auxiliary aids, all available free of charge. As a member, there are some responsibilities. This includes the responsibility to follow the member handbook, understand your rights, and ask questions when you want to learn more or you do not understand. Treat your providers, Humana Healthy Horizons staff, and other members with respect and dignity. Choose your PCP, and if needed, change your PCP. Be on time for appointments and call your doctor's office as soon as possible if you need to cancel your appointment or if you're going to be late. It is also important to show your member ID card whenever you get care and services. Grievances and appeals. Members or their authorized representative can file a grievance at any time over the phone or in writing if you are dissatisfied with Humana or any parts of your care. Members or their authorized representatives can also file an appeal over the phone or in writing within 60 calendar days of the date an adverse benefit determination is made. If assistance is needed, call our member services team. To mail a grievance or appeal, the request can be sent to Humana Healthy Horizons, Virginia. Grievances and Appeals, P.O. Box 14163, Lexington, Kentucky 40512-4163. Last but not least, here's an example of what the Humana Healthy Horizons in Virginia front and back of the member ID card looks like. As previously shared, it is important to show your member ID card whenever you get care and services. Lastly, here's an example of what the Humana Healthy Horizons in Virginia front and back of the member ID card looks like. As shared, it is important to show your member ID card whenever you receive care and services.
Sentara Health Plans has served Virginians for 28 years, since the beginning of the Virginia Managed Care Program. Sentara is the only Virginia-based managed care organization and is trusted by nearly 600,000 Virginians. A division of an integrated delivery network, Sentara strives to provide the best and most complete care for our members to improve health every day. Members have access to a network of over 53,000 providers across Virginia and also to Sentara's system of hospitals, primary and specialty care clinics, and urgent care centers. Members in Northern Virginia also have access to Kaiser Permanente's integrated health system through our exclusive partnership. Centera Health Plans strives to improve the health of our communities. Since 2022, Centera has invested more than $770 million into communities across Virginia and continues to offer care through our Centera Community Care Centers and mobile clinics. Centera Health Plans offers a variety of enhanced benefits to help our members along their journey to health and wellness. For our new moms, we offer access to nutritious food with a $75 grocery card every quarter. Our Safe Sleep program gives new moms a free baby monitor, sleep sack, or pack and play. Our Welcoming Baby program and baby showers provide new and expecting mothers with education about pregnancy, childbirth, and beyond. We offer extras to make life easier, like transportation for members and their caregivers to grocery stores, places of worship, and travel for other non-medical needs. We provide home-delivered meals after stays in hospitals and skilled nursing facilities, and pre-diabetic health coaching and weight loss. Centera Health Plans also gives members access to even more benefits for the things they need, like adult vision exams, discounts on eyewear, allowances for feminine hygiene products and incontinence products, and GED voucher program for testing and online prep for the GED exam. Our Centera Health Plans model of care is extensive, so for today, we'll talk about just a few of the programs we offer to improve the health of our members. We offer several pregnancy support programs, including the Welcoming Baby program, which provides outreach, education, case management, and follow-up by maternal health professionals, and the Maternity Nurse Navigator program, where Centera Health Plans nurse navigators work with pre- and postpartum members to help with appointment setting, connection to community and health plan resources, and maternity education. We offer extra support for kids, like a diabetes and asthma program, where case managers work with entire families to assist with managing pediatric diabetes or asthma conditions. Our school liaison program promotes health, well-being, and education within our school systems through in-school and community events. Centera Health Plans has a number of behavioral health and chronic care programs. Our peer support specialists with lived experience support members in addiction and recovery programs to help them to achieve goals in their journeys. Centera's Diabetes Transition Program connects those recently admitted to a hospital for a reason related to diabetes to give them access to care management and support they may need. We take our members' right to excellent care and service very seriously. Our grievances and appeals team is dedicated to addressing and resolving member complaints or concerns. Centera's customer advocacy team is a special team dedicated to addressing and resolving issues that affect our members. This team works with departments across Centera Health Plans to try to fix issues quickly. We also work to make sure we communicate to members in a timely manner about the things that impact them. Lastly, Centera's Service Recovery and Executive Escalation team focuses on reaching out to and working with members who express dissatisfaction with Centera Healthcare in surveys, social media, phone conversations, email, and more. As you can see, Centera Health Plans offers many benefits, programs, and services to support our members. We would encourage you to explore more through our website, CenteraMedicaid.com. Like and subscribe to our social media channels for news and information on Centera benefits, health-related topics, and how Centera is helping to improve our community.
Welcome to the United Healthcare Community Plan Member Education. My name is Amy Mendez, and I will be your host. Who we are. Our mission is to help people live healthier lives and help make the health system work better for everyone. All Virginians deserve affordable health care, including you. We have many plans to help you get healthy and stay healthy. Value-added benefits. Eligible members have access to a variety of enhanced benefits. One Pass Fitness for members ages 18 plus. Unlimited access to 300 plus gyms, premium YMCAs, and over 14,000 digital fitness options. Diaper rewards. Up to 500 diapers at no cost for attending prenatal and postpartum appointments. Sticks for Kicks Plus for members up to 18. Up to $100 in vaccine incentives at Foot Locker and Walmart. GED support for members ages 18 plus. Unlimited materials and support to complete the GED test at no cost. Menstrual supplies. Eligible members can receive menstrual underwear for free. Housing application reimbursement. Up to $80 in gift cards to reimburse housing application fees. Self-care. Mobile application for emotional health support at no cost. Doctor Chat by UHC. Chat live with a doctor 24/7. Weight Watchers. For members ages 18 plus, receive free vouchers. Social trip transportation. Free round trip rides to places of worship, grocery, DMV, DSS, gym, and more. Model of Care Care Coordination, MLTSS. Members have a variety of ways to receive care management support by making outreach to United Healthcare Community Plan member services at 1-844-752-9434 or via our nurse line at 1-800-842-3014 or using the TTY line services at 711. Chat 24 hours a day, 7 days a week to talk to an on-call nurse. Within 3 months of becoming a UHC member, a representative will perform a screening for care management services and needs to support the member in the community. United Healthcare Community Plan and the department provide LTSS long-term services and supports like private duty nursing, personal care, and adult day health care to help individuals meet daily needs and maintain independence in the community or a facility. Before receiving LTSS support and resources, a community-based or hospital team will assess members to determine if they meet the level of care criteria and need for LTSS. Contact your care manager or member service to learn about the screening process for LTSS. Member rights. Appeals. You have the right to file an appeal if you disagree with an adverse benefit determination that United Healthcare Community Plan makes about your healthcare coverage or covered services. You must apply within 60 calendar days from the date on the adverse benefit determination letter. Complaints. You have the right to file a complaint, a grievance, at any time. You will not lose your coverage for filing a complaint. Be sure to include details on what the complaint is about so that United Healthcare Community Plan can help. Ways to file an appeal and/or complaint. You may phone request to member services at 1-844-752-9434 or by using the TTY line at 711. Or you can submit via a written request and mail to P.O. Box 31364, Salt Lake City, Utah 84131 0364, or via fax at 1-801-994-1082. Member services. United Healthcare Community Plan's member service is available to help if you have any questions or concerns. Call the number at 1-844-752-9434 using the TTY line at 711 from the hours of 8 a.m. to 8 p.m. Monday through Friday. Or you may visit uhccommunityplan.com/Virginia. Attention, and please note, if you do not speak English, assistance services are available to you for free of charge by calling 1-844-752-9434 or by using the TTY line at 711. You may also see Cardinal Care Member Handbook for additional information or visit dmas.virginia.gov and dmas.virginia.gov/for-members/Cardinal Care. We have also included the VA CCC Plus Handbook PDF. This concludes the presentation. We want to thank you for being a valued member of United Healthcare Virginia Community Plan.
Well, thank you so much for hanging in with us and viewing that educational session. We want to thank everybody who took the time to participate in the recording of that video. We also want to remind everyone in attendance that this particular slide deck information and the recording from today's live Q&A will be on the member Cardinal Care webpage on the DMAS website. We will drop the information in the chat for everyone before the end of the live Q&A today. And if you have any additional questions about access to this information, again, just drop it in the Q&A session. So before we get started with our live Q&A, I want to give our subject matter experts from our MCOs an opportunity to introduce themselves. And so we're going to first and foremost ask that the leads for each of those managed care organizations come off mute. And if you just want to introduce yourself or introduce your entire team, that's completely up to you. So we'll start with Aetna and Corey Pleasance.
Good morning, everyone. My name is Corey Pleasance. I am the Chief Operating Officer for Aetna Better Health of Virginia. And with me on my team, I have our Tresserlyn Lawson-Kelly, our Director of Marketing and Community Development, and Lilybell Quinones, one of our faithful community outreach specialists. We are looking forward to speaking with you all this morning. Thanks.
Thank you so much, Corey. Next, we'll have Anthem and Claudia Blackerley. I know I butchered that.
Good morning, everyone. My name is Claudia Balcarcel, and I'm the manager for the care management line and the transportation manager. Thank you for having me.
And good morning, everyone. Oh, sorry.
Oh, Claudia,
Go
are you
Anthem.
introducing everybody on your team, or is everybody introducing themselves? I'm sorry.
I will pass it along to Shanice.
Okay.
Thank you.
You're welcome.
Thank you. Good morning, everyone. My name is Shanice Gangadine, and I'm the Director of the Foster Care Program, and I'll pass it over to Precious Caravello.
Good morning, everyone. I'm Precious Caravello, and I'm the Director of the LTSS Care Coordination Team here at Anthem. I'll pass it to Brian.
Hi, good morning. I'm Brian Hawkins, and I'm the Director for the Healthcare Management Team here at Anthem, and I'll pass it over to Ann Catlett.
Good morning. My name is Ann Catlett, and I'm a manager on our behavioral health team. Thanks for having us.
Is that everybody, Claudia?
Yes.
Okay, thank you. All right, next we'll move on to Humana and Carrie Whitaker.
Thank you. This is Carrie Whitaker. I'm our Director of Contract Compliance with Humana Healthy Horizons, and I will pass it over to Eric Taylor.
Good morning, everyone. Eric Taylor, Director of Consumer Experience with Humana.
And also on the line, we do have some of our clinical folks. So if there's any questions related to that, they'll be able to assist.
Excellent. Next we have Centera, and and that'll be Tammy Forbes.
Good morning. I'm Tammy Forbes. I'm the Director of Chronic Disease Management and Transitions of Care, and I will pass it over to Jamie Edwards.
Good morning. I'm Jamie Edwards, Director of Case Management. I also have Lori Schweitzer and Rosemary Kidd that are managers of case management. I will pass it over to Felicia.
Hi, good morning. Felicia Graves. I'm the Senior Director of Medicaid Operations. Happy to be here, and we'll pass it over to Lavinia Smith.
Hi, I'm Bea Smith, and I'm the Senior Director of Strategy and Innovation. I'm here at Centera, and I believe I may be the last one on our team. We have several folks in support in the background, though.
Thank you so much. And last but not least, we have United, and we're going to have Ryan May.
Hi, good morning, everyone. I'm Ryan May. I lead our dual special needs programs here in the Commonwealth of Virginia. Joined today on the phone with our team is Teela Tyler. She's a senior community outreach specialist here located in the Richmond area. We also have our director of provider partnerships, Amy Mendez. Amy did a great job on recording the session for this morning. She also recorded the same version for members in Spanish, which will be outcoming soon. And she also did some work with our provider-facing presentations. Those sessions are later this week. Happy to entertain questions, and thanks again for the time and energy.
All right, thank you so much to all of our subject matter experts from our managed care organizations. We do have a home team, which is at DMAS, and there are many that are helping and supporting in the room, but also external to us. If we get any or receive any questions that will be directed to them, we will give them the opportunity to come off mute, introduce themselves in their role here at DMAS. So let's go ahead and move forward. One additional reminder before we get started. If you are a provider, we are so happy to have you to listen in and make sure that you understand the needs of our members. But we also want to remind you to please wait to ask your questions during the provider session that will take place this Friday. The sessions will be held on the 13th at 10 a.m. and 2 p.m. The event details and login information can be found on the DMAS Providers Cardinal Care page. These events will feature DMAS and MCO representatives able to answer provider questions regarding MCO points of contact, provider enrollment processes, and billing. So please, thank you in advance for your attendance and your engagement, but also for transferring those questions over to that time and day. All right, so thank you again. So next, we're going to go ahead and get started with these lovely questions. We see so many that have come through. And so first and foremost, in the presentation itself, we talked about Cardinal Care Managed Care. And so, of course, we have just a basic question as to what is the Cardinal Care Managed Care program? And the Cardinal Care Managed Care program is Virginia's new Medicaid managed care program designed to improve healthcare access and service delivery for Medicaid and famous members through contracted managed care organizations. That's what we are, that's what we're doing, that's why we're here. So when does the Cardinal Care Managed Care program take into effect? Well, the answer to that is that its implementation is scheduled for July 1st. Clear cut, simple, and as you saw in the presentation, we have a little road map for that. And so we refer you to that particular document to get more information about what that process looks like. So which MCOs have been awarded the Cardinal Care MC contract? And each of them just introduced themselves. We have Aetna, Anthem, Humana, Sentara, and United. All right, so is there an updated chart that provides a side-by-side comparison of benefits between MCOs? And yes, there is. It's the Medallion 4 added benefits comparison chart, and we will drop in the chat the link to that chart so that you will have access to it. So let's go to some live questions. One that came in is, can I use my Cardinal Care plan out of state for self-care while visiting and assisting an elderly aging parent? And so we're going to have Sarah Cariana come up and answer that question, and she'll introduce herself and what role she plays here.
Yeah, good morning. My name is Sarah Cariana. I'm the Director of Eligibility Policy and Outreach here at DMAS. So the changes being made to the Cardinal Care Managed Care program are not changing the current requirements for out-of-state services covered by Medicaid. Generally speaking, Cardinal Care will only cover these out-of-state services in pretty limited circumstances, such as when emergency services are required or when prior authorization to receive out-of-state care is granted because the service or care that is needed is not available in the state. We do encourage members who are enrolled in managed care to reach out to their MCOs directly for more information about their MCO provider networks, if there are any out-of-state providers included in those networks, and there are additional policies regarding out-of-state care and how to get authorization to receive out-of-state care.
Thank you so much, Sarah. All right. Next, we have how do we learn which of these providers is in network for my address? And we have Cardinal Care Managed Care website, and the Virginia Cardinal Care mobile app can drop these links into the Q&A if necessary. That's two very helpful resources for you. And if you have additional ones about your individual MCO, we have representatives here today, and you can drop those questions in the live Q&A, and we can get those members to answer those for you if necessary. All right. For the DSNP, what happens if they are not aligned? What actions do we need to take? And so we're going to have Lynn come up from DMAS, introduce herself and her role, and answer this question for you.
Good morning, everyone. My name is Lynn Best, and I am a member and provider relations specialist, and I'm so happy to be here with you today. So if that happens, you can call our Maximus enrollment broker. We'll be dropping this information in the chat as well, but it's 1-800-646-2273, or you can go to virginiamanagedcare.com. We also have a mailbox, which is ccc+@dmas.virginia-spelled-out.gov. And I and a few of my other team members answer those emails, and we will also be happy to call you and talk to you about anything that you need regarding your plans. So there is also a DSNP mailbox that we'd like to put in the chat, and that is dsnp@dmas.virginia-spelled-out.gov. So we will add all these resources. So again, that Maximus phone number is our member helpline, and they have all of these resources and are really happy to help you. And hopefully when you call them, they will be able to help you get aligned. So thank you.
Sounds good. Thanks, Lynn. All right, we're going to have Carrie, I just want to call her that, Sarah back up for another question. And it's a very specific question, but I think one that many of our members have. For Medicaid, what is the income eligibility for a four-person family? She's on her way up.
Good morning again. So first, I just want to provide a bit of broad information in that Medicaid and FAMUS in Virginia are programs that have many different what we call categories of coverage. So for different populations, there are different eligibility rules. Generally speaking, for children and pregnant individuals in a household of 4, the monthly income limit is $5,493 a month, which equates to about $65,908 a year. For an adult who's between 19 and 64, it's $3,698 a month, which is $44,367 a year. We always encourage individuals, however, to apply and not make an assumptions based on what income does count, doesn't count, and always keep in mind that other factors such as having a disability or needing long-term care and having received a screening for that care do change how we look at income sometimes. And so please just keep those in mind and don't just assume based on those broad numbers that you are or not eligible.
Thank you so much. All right. Next, we have some questions for one of our MCOs. So Humana, if you can be ready. So for a member transitioning from Molina to Humana, will the new plan honor Molina prior authorizations and allow transitioning members to see providers who are not in Humana's network for the first 90 days? Let me know if you need me to repeat that, Carrie.
No, I got it. Thank you very much. And thanks for
You're
asking
welcome.
the questions. We will honor prior authorizations and allow them to see their current doctor for the first 60 days, not 90. And we are happy to work with our new members to see if we can get their existing providers in our network if they are not already in our network.
Excellent. Don't go anywhere. I got a couple more for you.
Uh-oh. Okay.
So,
in the hot seat.
All right. When will the Find a Provider tool be available on the Humana website for the network serving Virginia Medicaid?
When will the Find a Provider tool be available on our website?
It should be there now.
It should be live now.
Is it any way you can tell our members where to find it on your website?
Yeah, hang on one second. we pop that in the chat after we locate that for you?
Oh, excellent. Yes, you can pop that in the
Okay,
chat.
great. Thank you.
Excellent. Don't go anywhere. Still got another one for you.
Uh-oh.
Is it too late to be credentialed through Humana by July 1st?
Credentialing typically takes 60 days. I'm not a credentialing SME, so I'd have.
What if your PCP is not in network with United Healthcare? What if the medications are not covered? And if you're changing companies, is the coverage less?
Hey, good morning. It's Ryan. It's Ryan. I'll start with it, and I may ping Amy on our provider side. But generally, when we look at a PCP, if they're not in network with United, a couple of options. One would be for the provider to engage with us to consider becoming part of the network. Additionally, you could get help through your care coordination to find a PCP who is in the network as well. And for the medications that aren't covered, that's a conversation often with a primary care physician to see what medications might be covered, what alternatives there might be. The last question about why changing companies, I'm not sure that's directed to us. It may be looking for more information around the Molina change to Humana. I'm not quite sure. Amy, anything to add there around PCPs that are not in our network?
Sure. Hi, and thanks for punting over the question, Ryan. I would also say currently right now our network is also under review. So I encourage any provider that is interested in joining the network to actively apply and reach out to us. And we will go into further details on Friday on how to do that. So I appreciate the opportunity to answer the question.
Thank you
Thanks,
both.
Amy. Sure.
All right. So next we have a question that is there a plan to save the Medicaid Advantage on the state level when its budget is cut? If not, will the governor's access plan or something come back, or are we to just use hospital emergency rooms? Let me see if all right, this question is open to all of our MCOs. And so we have a lot of issues. Well, this is coming from a member. They have a lot of issues not having providers on the Eastern Shore of Virginia. And so they're currently with one of the MCOs, but do any of you have any plans to have more providers on the Eastern Shore? And I'll just take it one by one. So Edna, if you would like to answer this first.
Sure. So we always, we undergo continuous, reviews of our provider network, always looking for gaps.
So we'll continue with our live Q&A panel discussion. We'll make sure continues to submit those questions. We're going to be answering them live, and we'll make sure to pull them into a frequently asked questions document if we cannot answer them today. Oh, and one thing we did forgot to mention at the very beginning was that this we want to acknowledge that our protected health information is a personal health information that can potentially identify an individual that was created, used, or discussed in the course of healthcare services. So as always, DMAS and its contractors want to do everything we can and possible to support the privacy of our members. And to that end, please note, do not place any protected health information in the chat or sharing in a question. If you choose to do so, please make sure that you understand the consequences of doing so, and that this information is being both heard and shared. This meeting is being recorded, and we're also taking notes. So let's get back to the question at hand. And I believe that Corey was in the middle of a brilliant answer to the question. We have a lot of issues. Personally, sometimes they have lots of issues in not having providers on the Eastern Shore of Virginia. And so what is each of our managed care organizations doing to address this? We apologize again for disrupting your brilliant answer, Corey, but could you repeat it for us?
Sure thing. Yeah. So I was just saying that we at Aetna, we have a pretty large and robust contract monitoring and network management team that is, always monitoring our provider network to make sure that we have, equitable access across, the entire Commonwealth of Virginia. So, I encourage anyone, that is interested in seeing what providers we offer in the Eastern Shore to please take a look at our provider directory at aetnabetterhealth.com/Virginia/find provider to take a look. And I'll also take a note to go back to my team to take a look at our network, more specifically in the Eastern Shore, to see if we have any gaps that need addressing. But please feel free to take a look at our existing provider network. And I think you'll find that we have a very robust network throughout the entire Commonwealth of Virginia.
Excellent. Thank you so much, Corey. Claudia, for Anthem or someone from your team, can you answer that question as well?
Yes, this is Brian from Anthem. We also continuously monitor our networks to ensure that we have adequacy in all areas. We look for opportunities for contracting providers, whether it be primary care providers or specialists. But we can also take this specific question back to our provider team to discuss the Eastern Shore in detail. But if you would like to look at our member website to see providers who are available to you, I'm not sure what specialties you are looking for. You can take a look at our member website to see what providers are available in that area. And we also have telehealth available that can be leveraged in rural areas to help kind of bridge that gap.
Thank you so much, Byron. All right, a representative from Humana.
Hi, good morning. This is Eric Taylor. Just sharing, as the other plans have, that we are constantly monitoring and recruiting, but I did confirm that we are doing special recruitment for the Eastern Shore area. So that is our update, and hopefully that covers what's needed.
Excellent. Representative from Centera.
Hi, this is Lavina Smith. We are doing exactly what the other plans are doing too. We're actively recruiting, constantly recruiting and evaluating our networks. And we do have assigned team members for that area that are actively recruiting. And we do have telehealth, which is available statewide for both medical and behavioral health needs for our members to help assist in closing those gaps.
All right, thank you so much. And last but never least, United.
Hello, thank
Hey.
you for that. Amy, I can answer it, Ryan. Thank you.
Go ahead.
So at United, we are consistently evaluating our networks, not just for specialty care, but for preventative care as well too, for adequacy. Particularly in the Eastern Shore, we are aware that we are consistently looking to expand our network there. And in doing so, not only do I work directly with our network teams to get that done, but as well as continuously monitor it to make sure that we have the right providers available to our members. In addition to that, we have availability through Dr. Chat, and so that members can actually have access to care in those particularly difficult areas. But I will continuously take this back and make sure that our network teams are aware and we are consistently working to expand our network in those areas. Thank you for the opportunity.
Thank you so much. All right, so let's jump into some other questions that came up around maybe enrollment in some plan selection. What happens to Molina Healthcare members? And Molina Healthcare will exit the Cardinal Care Managed Care after June 30th, 2025. Members currently enrolled in Molina will automatically transition to Humana Healthy Horizons of Virginia starting July 1st of this year. They will have until September 30th of 2025 to switch to a different health plan if they so desire. All right, what is the special enrollment period for the Cardinal Care Managed Care? Again, Medicaid and famous members can either stay with their current plan or switch during the transition period, and enrollment period is June 19th through September 30th of 2025. If selected on or before the 18th of the month, that change takes effect on the 1st of the next month. If selected after the 18th of the month, the change takes effect on the 1st of the following month. So the next question we have up is, can famous members choose their health plan? Yes, famous members can now select their health plan through the health plan enrollment broker. So that was an easy one for you. And where can members find out which health plans work with their providers? Members can visit the Virginia Managed Care website, which helps them see which health plans work with their doctors and medical providers. They can compare plan benefits and select a new health plan if they wish to switch. All right, so let's move on. We have who will be enrolled in the foster care specialty plan. And so the foster care specialty plan will be administered by the Anthem Healthkeepers Plus. They will enroll eligible members in foster care, adoption assistance, and the former foster care. Tidewater and Central Virginia regions and Molina members will be automatically enrolled on July 1st of this year. All other regions will be enrolled on August 1st of this year. What additional benefits does the foster care specialty plan offer? The foster care specialty plan members receive a dedicated support line, and it's active Mondays through Fridays, 8 a.m. to 5 p.m. And that number is 1-833-838-2605. Again, that's 1-833-838-2605. And care management supports specialized in child welfare is available, as well as resources such as academic rewards, travel assistance, Chromebooks, clothing support, and enrollment incentives. I want to give additional questions that we also have around. Oh, I did want to give Anthem an opportunity to expand on anything from the foster care specialty plan not already mentioned, if you wanted to do so, just to make sure we're highlighting what's truly important about that plan and its management.
Thank you. And this is Shanice Gangadine, the Director of Foster Care for Anthem. You did a really great job of running down everything. Some additional things I would like to note is that Anthem has specialized positions that are dedicated to our youth in foster care, such as our judicial liaisons, our transition age youth liaisons, and we also have additional value-added benefits that, such as our, for our transition age youth 18 years or older, we do provide a $100 gift card to allow for purchase of public transportation pass, a $100 ride share card, or a $100 gas card for transportation for our transition age youths, as well as a family movie night, as we spoke about in the video. And all of these benefits can be accessed by connecting with the Anthem Foster Care Specialty Plan case manager.
All right, sounds good. All right, so let's go on to some member support and resources. So we also have how will members be notified about the transition? All enrolled members will receive notification in the mail with information on their new health plan and their special enrollment period options, so no worries there. Where can members access help with switching health plans? Members can use the Virginia Managed Care website or contact their new health plan's customer service for assistance, and they all mentioned that during the presentation what those connection points and numbers and emails are. What happens if a member does not select a new plan by September 30th of 2025? After September 30th of 2025, members must wait for the next managed care open enrollment period in 2026 to change plans. So that's why it's imperative that our members who are attending and listening today have the opportunity to hear all the ways in which they can do that successfully. So let's go back to some of our Q&A to see if we have any additional ones that have popped up. Which MCOs, what does the vision and dental provider network look like for each of the MCOs? And yes, and so we can get all of our MCOs to speak to that. And let's start from the bottom and work our way up this time. And so we'll have United start, and then we'll go up the chain.
What was the question again? Is it related to Eastern Shore, or is it a follow-up?
No, it was just what does your dental and vision benefits or network of benefits look like for your individual MCO?
Oh, okay, gotcha. Thanks for the question, Tila. If you're available to cover that one for us, the question is really related to our dental benefits that we offer for our Cardinal Care Managed Care contract across the Commonwealth. I will preface that as Tila comes off mute. often we hear things and questions about the network and adding more providers and long wait times to get in with the dentist. And we hear that, we know that, we experience that as well. Personally, for my experience, it's been 6 months, sometimes a year for dental appointments as well. So it's not something that's just housed within our space and what we're doing here, but there is definitely tons of opportunity for growth in that space of more dentists in the market and more folks contracting. But Tila, do you have the specifics about the dental plan you could share?
Yes. So the
and if you could
Medicaid.
have it focused on the member experience, that would be fantastic.
Yes. Can you hear me?
Yes, a little
Okay.
better. Yeah.
All right. So the Medicaid dental provider is Cardinal Care Smiles. And we can get that link in the Q&A's portion. They are available to assist with finding a dentist. They have care coordinators available, much like your MCO providers. And also for United Healthcare, the vision provider is March Vision Care. And we can also get that into the Q&A portion as well. So those services are carved out through a third party. So the dental is the same for all the MCOs, Cardinal Care Smiles, and then United Healthcare's vision provider is March Vision Care.
Excellent. And I was going to circle back to reinforce that point that the dental plan is the same for all. The Virginia Cardinal Care Smiles Medicaid dental program is recognized as as the oral health program provider, and it's administered. It's administered by DentalQuest. Children, pregnant women, and adults enrolled in Cardinal Care Smiles receive a comprehensive dental benefits. You can use the Find a Dentist tool on dentalquest.com to find a provider near you. Or call the member services at 1-888-912-3456. But as far as the vision component of it, if each of the plans could speak to that, that would be fantastic. United did a fantastic job answering that question from the dental standpoint. But Centera, do you have anything to add regarding your vision component?
Our vision is managed by VSP.
Okay, and how can members access that information and navigate it?
I will get that information and put it into the Q&A. I'll put the link there for them.
Okay, sounds good. And
Thank you.
Jimena, you're welcome.
Thank you. As you mentioned, we do use the same dental providers, the rest of the MCOs for vision. We use iMed, and you can find information on the back of the member ID card, or we can pop in the chat our website.
Thank you. Anthem.
Our vendor for vision is iMed, and members can locate providers by either calling member services or using our member website.
All right, and Aetna?
Yep. So for Aetna, our vision benefit is monitored and managed through VSP. And so members can contact VSP directly at 1-800-877-7195. This information is also available in our member handbook. And just to also, add so folks know, we also offer our members a value-added benefit for eye exams and $125 for glasses or contacts per year for members age 21 plus. All this information can be found on our website in our member handbook or directly through VSP.
Thank you so much. And we've gotten a few questions about sometimes the difficulty of having access to certain benefits like vision or finding providers for PCP. Just one or two, all of you, if you would like to speak to, what would be the proper process for a member who is finding it challenging to find a provider in any particular benefit area?
So this is Corey from Aetna. I can go first. So our member services call centers are, fully informed and aware of how to access and assist members with accessing our benefits, getting information about providers. So our member services call center number is 1-800-279 1878, and we have a member services center that is available 24 hours a day, 7 days a week. But any question around how to access a value-added benefit, whether it be transportation, vision, some of our value adds around education supports and services, all this information can be found through our member services call centers. Additionally, if a member has a care manager, our care managers can also assist in getting access to these benefits as well.
All right.
This is Brian. This is Brian from Anthem. Pretty much the same answer, the same response. Members can call our member services line. Our member services staff is fully equipped to assist with locating providers. Also, when there are more complex needs, the member services team may refer the member to our case management staff, who can provide additional support.
Excellent. Any other managed care organizations want to respond to that?
Good morning. This is Eric Taylor from Humana, and the same applies. The member can always call in our members.
Oh, you went low, Eric.
I'm sorry. Can you hear me?
Yes, lean into the mic a little bit more if you can.
Got it. No problem. So the member can always call into our member services call center, and that number is 844-881-4482. As well, if there are complex needs, the care manager will always be able to assist them in helping to find a provider.
Excellent.
And for Centera, our members can contact member services through 1-800-881-2166, or look on the back of their ID card. Those numbers are there as well. But any individual that they're engaging with at the health plan should be able to assist them in connecting them to their case manager or to member services that can assist them with that. As well as if they're discharging from the hospital, their transition to care coordinators can also assist in identifying and locating new PCPs as well.
Fantastic. Fantastic. All right. We have a couple of questions around, again, accessing provider networks. And so we just talked about care management. We just talked about accessing certain phone numbers. Can anyone speak to the experience that a member would have if they are unable to find a provider at all? And they're in your plan, what would you advise, what steps you would advise they take? Is it anything in addition to calling the customer care line?
Hi, this is Brian from Anthem again. If there's a member who's having complete difficulty in locating a provider, for example, a provider that is not located, that needs to provide specific care that's not located in the state, or et cetera, there may be special circumstances where an authorization is required for the member to see an out-of-network provider. And we would provide assistance with that. Our care management team or member services would provide assistance in giving the member guidance on how to start that process, and that would normally start through their primary care provider. Excuse me.
Excellent. Anyone else?
Yeah. We also have dedicated care managers that can assist a member in locating a provider. Again, if they are out of the network, we can work with them on that. And if they have specific preferences to providers, such as language needs or anything, we can assist with that as well.
All right. All right, we have another question that came in. For the members of plans that offer holistic services, such as financial support or GED or housing applications, do these members access this support through the care coordination, or can they do so directly on their website, on your website? And any plan in all plans can answer that question. That applies.
They can do both. This is Humana.
Hi, this is Brian from, oh, sorry, go ahead.
Sorry, you go ahead, Brian. Oh,
yeah, I was just going to say, this is Brian from Anthem. So since all members may not be in care coordination, members can call our member services line to request assistance with accessing any of our value-added benefits.
And this is Shanice from Anthem, the foster care specialty plan. You can also contact the foster care specialty plan's dedicated line to help to get assistance with accessing those value-added benefits from the dedicated care manager, as well as online.
This is Corey from Aetna. So the answer for Aetna kind of varies. It depends on exactly what benefit is trying to be utilized. I would say, from a generic perspective, if you want information about all of the value-added benefits or enhanced benefits, a member can reach out to our member services call center. However, we do have some benefits, such as our new mom stipend, right, that do require enrollment in maternity care management. And again, this is not to make it harder for the member to get the benefit. It's just that we feel that the care management, the benefits of care management in conjunction with utilization of the enhanced benefit will be most meaningful for the member. So again, if you want to find out just generally information about our value-added benefits and whether or not it is required to be in care management, please reach out to our member services call center.
Excellent. Wonderful. Anyone else? I think we heard from 3 of our 5 plans, and it may not apply to any more. Okay. A couple of questions have come in around behavioral health services. I know you touched on them a little bit in your synopsis in the video. Does anyone want to highlight any particular value-add benefit that is a part of the plan that you offer around behavioral health?
So this is Centera. We do have, we have our BME, which is focused on our adolescents age 12 to, they've extended to 24. That's focused around behavioral health coaching and suicide support for that age group. Then we also have our Virginia Youth to Adult, which provides behavioral health support, behavioral health and IDD, DDD supports. So if an individual has a new diagnosis of ADHD or their child does and they're 10 years old, they can go and put the age in, put in the diagnosis, and it'll provide all the resources within the state and some federally to help connect the caregiver, the teachers, the educators, the providers, the family, the individual members to information about their diagnoses, as well as connecting to Bridging Apps, which is a curation of thousands of applications and articles that have been clinically tested and approved to help support individuals with behavioral health and substance use needs.
Fantastic. And thank you for that detailed overview.
Yeah, and I can put the link to our Virginia Youth to Adult, which is open to any individual. They do not have to just be a Centera Health Plan member, and I'll put that link in the Q&A as well too.
Thank you, Centera. Any other plan want to speak to this as well?
This is Anne from Anthem, and I just wanted to let everybody know that we do have some preferred providers for behavioral health. So if you're having difficulties getting in with a provider or the wait time is too long, we encourage you to call your case manager and member services so we can assist you to get in. We also have digital mental health toolkits that are available, online recovery support programs, and sensory solutions for some of our members.
All right. And just as a point of clarification, if you all can repeat the question, you can hear, oh, don't need to repeat the question now. I think we're good. Okay. All right. So thank you so much, Anthem. I see Centera and Anthem has answered this question. Does anyone from our United Centera, well, not Humana or Anthem want to answer? Not Anthem, Aetna.
Yeah, this is Corey from Aetna. Yeah, so we've got a couple of really cool initiatives around behavioral health. So as someone else mentioned, we also have a preferred provider program where we partner with, key behavioral health providers throughout the Commonwealth of Virginia that we know are top-notch and really top quality providers that are servicing our members. We also have MD Live, which is a 24/7 virtual behavioral healthcare tool, available to members, ages 10 and up, and it serves as an alternative solution to in-person in behavioral health care to help further close some gaps on some BH access challenges that we know are across the state of Virginia. We also have our Justice Involved Care program. And so, it is a program that is designed around providing additional, administrative behavioral health supports, for members who have been in the justice system in some way or another. So, we also provide them with Thrive mobile, phones that offer, unlimited text, talk, and data, with preloaded apps for those members to utilize to support their transition back into the community. So we've got a number of programs that we encourage folks to take a look at our website for more information.
Hi, this is Amy from United Healthcare. On the behavioral health question, I just wanted to point out that one of our team members has put out some information on the Teams chat, as well as wanted to also mention that we encourage our members to work with their care advocates to help them find potential behavioral health providers that could help them with their needs, as well as we have our Dr. Chat Online that also assists, and many other tools that we have on our member portals as well to help them find a network provider, which we will also cover during our provider sessions on Friday as well too. But please look at the chat. I believe we have placed some information in there as well.
Okay, can everybody hear me?
There's a little bit of an echo.
Yeah, there is. Can you hear me now?
Yes, that's much better.
Yeah, we're experiencing a little bit of an echo. Is that better?
Yes.
A little better. Also, I'm getting reports that on the guest line, they're having audio issues.
Yes, we've been trying to figure out what that looks like. So we're trying our very best to navigate it. Before we close out, we want to make sure that our members know. Before we close out, we want to make sure that our members know how to get access to, it is an echo in here, I'm sorry, it's taking a moment. We're trying to figure out how our members can have access to navigating and providing feedback to each of our managed care organizations. I know each of you have a process for that. If our members wanted to get involved, provide feedback, or learn more about how they can continue to help you improve the system for Medicaid members, what would you advise they do?
I can answer for Aetna. So we have a Medicaid advisory committee, that we definitely encourage, and want members to join. So members can reach out to member services to request more information about how to join the member Medicaid advisory committee, as well as if they are a member in CM, they can reach out to their care manager. And we also have an email. It is vaoutreach@aetna.com, and happy to have somebody from the team drop that in the chat. And members can also, reach out with, inquiries about joining the member advisory committee, any recommendations or suggestions for things we should consider going forward. But we definitely encourage and would love to have more members participate in our member advisory committee meetings.
And that answer would pretty much be the same for Humana. We also have the member advisory committee, and they can reach out to member services as well and their care manager.
The same would also apply for Anthem as well. We do value, any recommendations or feedback from our members.
And it would apply for Centera also.
Yes, and the same for United Healthcare as well. I will put the number in the Q&A section where if you are interested in attending a meeting, you can either call or prefer text to one of our outreach team members, and they will be sure to add you to the list and get an invite to you for the next upcoming session.
All right, we want to thank everyone for attending today. Thank you so much for your engagement, your patience as we continue to navigate the technical difficulties we were having this morning. Thankfully, we have 2 of these today. So hopefully, if you were unable to hear us or unable to participate, you can join us again this evening at 4:30. Thank you to all of our MCOs for being here this morning and returning this afternoon. If you have any additional questions, please don't hesitate to submit them via the form that is still located on the website. We are happy to have all of you back at 4:30. And do not hesitate to visit our website, the Cardinal Care Managed FAQs, or just reach out through the app. We're happy to have it all. So thank you so much. Y'all have a lovely day, and hopefully we'll see you back at 4:30.
Thank you.